Today we shall learn about free gingival graft. In this particular case, we will see how free gingival graft can help increase the width of attached gingiva, especially in cases of mandibular class 2 recessions, where the recession extends up to the mucogingival line. This line represents the mucogingival junction, and free gingival graft would be used to increase the width of attached gingiva. Okay, so most common, there are 4 steps that are involved in free gingival graft technique. First of all, we will be preparing the site for receiving the free gingival graft. Second would be to harvest the free gingival graft, and the most common site for that is the palate, distal to canine up to the first molar. So first step would be preparation of the recipient site. Now that involves using a blade, most commonly the 15 number blade, where a horizontal incision is extended on either sides of the recession, followed by vertical incisions which diverge and cross the mucogingival junction, and a partial thickness flap, that is some portion of epithelium and the connective tissue, is removed so that a clear epithelial bed, a clear connective tissue bed is present to receive the free gingival graft that will be obtained from the palate. So once the horizontal and vertical incisions are given, we will be removing the portion of epithelium and some portion of connective tissue. So that leaves periosteum and portion of connective tissue remaining onto the recipient site. This is the area which will receive the free gingival graft. So the whole purpose is to increase width of attached gingiva apical to the recession. Our target here is not to achieve root coverage, but to increase width of attached gingiva. So this is the recipient site preparation. Now a template is created which will give us idea how much amount of graft we need to harvest from the palate, and accordingly the site is selected. So free gingival graft can be harvested from the palate. As I said, the extension is from distal of canine to the distal of first molar. That is normally the zone. It should be about 2 to 3 millimeters away from the gingival margin, and outline your area of graft that you want to harvest. Once we achieve this, we can start harvesting the graft. Remember, the ideal thickness that is required for a free gingival graft is 1 to 1.5 millimeters. Anything which is thinner than that will necrose. Anything thicker than that will not be able to allow nutrition or blood vessels to survive, to make the graft survive. So 1 to 1.5 mm is the thickness. A general idea is how much a bevel is present on a 15 number blade, that much depth can be achieved. You can insert the beveled portion into the epithelium and connective tissue, and that could give us an idea of 1 to 1.5 mm of thickness. Once you achieve that, start reflecting it along the borders without getting too deep. And because there is a greater palatine artery below this graft, you need to be very careful about how much we are going to go deep. That's why 1 to 1.5 mm is an ideal thickness for a graft. So you release the graft from all the sides, what you had bordered initially depending on the template based on what recipient side was prepared, and now this graft can be taken That was the second step. First step was preparing the recipient bed. Second is to harvest the graft. Second is adapt this graft onto the recipient site. You can use tissue forceps, and this will be the site where the graft is placed and firmly adapted onto the recipient bed. That is because you don't want any dead space between the recipient bed and the graft. Once it is firmly adapted, you can start suturing the graft. The sutures are given in the coronal area of the graft on either sides of the recession defect, one at the lateral ends, one each at the lateral ends, and if required you can give periosteal sutures also to stabilize the graft. So this is going to create a zone of attached gingiva around the teeth which had class 2 recession crossing the mucogingival junction. Now this generally needs about after you have secured the graft, the last step would be to make sure that you have sutured the donor site with suspending sutures so that the bleeding is controlled. Okay, so step 1 is preparing the recipient site. Step 2 is harvesting the graft from the palate. Step 3 is stabilizing the graft, and step 4 would be suturing and maintenance of the donor site. Now this graft will be covered by a periodontal pack or dressing which will be removed after 1 week. Suturing would be removed after 2 weeks. So that's how free gingival graft can be used to increase the width of attached gingiva around class 2 gingival recessions.